People smile when they see that there is a garden and there are people in it.
Food as Medicine initiatives can be grouped into three major buckets. One is our garden that we're sitting in the middle of right now. The others are cooking classes, our culinary education. And then our third area is produce prescriptions. This garden has been here as long as Brian Boyce, our lead farmer, has been on staff.
We started groundbreaking kind of in February of 2020. We have one large construction project to go, which will be the most significant.
We will be using that shade structure for our cooking classes, hopefully for gardening classes.
Nutrition, composting, any number of things are possible in the classroom. In the future, we may be specifically providing food for classes, which we do to some degree now.
We implement a cooking curriculum called Cooking Matters. It's a national evidence-based cooking curriculum that's intended to support low-income families, especially caretakers of children ages 0 to 5. The vision is that we would be offering food demonstrations that showed people how to use the food that they could bring home from the garden. We have a regular class. We are now doing it bi-weekly. Our patients join us on Zoom. They're encouraged to cook alongside us, so we have a synchronous class. If they are not choosing to cook at the same time, they can at least watch and engage, ask questions, and get the experience and then also the materials that they need to make those recipes at home.
Produce is harvested every morning and put in 3 different areas to be distributed in the behavioral health, the primary care, and the dental areas.
And that's part of our culture, to have our own vegetables at home, to grow our own staff.
People are letting us know what they like and what more they'd like to see out of the garden.
We want them to see here with CommuniCare that we are part of them, part of the family. We know how they feel, we know how they work, and we want them to know that we're learning from them.
In the future, we hope that you will also be able to meet with your provider, and if you are experiencing a diet-related disease, you would be connected with food prescriptions, where you would be given the means to be able to access healthy food as a very integral part of your healthcare experience.
La comida es medicina, I would say in Spanish. If we eat healthy, we're going to be healthy.
Food is the basis of our existence. It's how we survive, and therefore it's how we can thrive as well.
Being a patient at the clinic helped me find out about this whole garden. As I continued being a patient, I suddenly noticed there were vegetables, and every time I took a bag, I just felt fantastic.
Those experiences are contributing to more and more evidence that shows that by providing people with healthy food early on and connecting that to their healthcare experience, we are down the road seeing lower rates of chronic disease among those people that are getting food in the medical context.
I now have my whole diabetes under control, like even below pre-diabetic level. Any vegetable I choose to eat just creates a great improvement in everything. Thought process, alertness, physical stamina, happiness, strength. So in that sense, if that's medicine, that's medicine.
We need nutrition, and we are healthier with better nutrition. It's the most basic medicine there is.
What we're doing here within CommuniCare is providing people with access to produce and with the education to be able to use that produce so that they can also adopt healthier lifestyles and reduce their risk.
I want people to be able to move and to be able to do the things that they do and enjoy, family and life experiences. But again, still kind of like, not forgetting, who we are as, individuals and, and bringing in the different cultures, but to try to kind of expand, just having these different experiences and different foods and different tastes. I think that's the fun part.